Hey everybody, welcome back. This is going to be continuing the series of how different therapeutic approaches treat different diagnostic conditions, and today we're doing cognitive behavioral therapy with ADHD. So without further ado, let's jump in. Okay, cognitive behavioral therapy is one of the most evidence-based and widely used psychotherapies for ADHD, often used in conjunction with medication. Unlike purely psychodynamic or humanistic approaches, CBT is highly structured, goal-oriented, and focuses on practical strategies to address the cognitive thought patterns and behavioral symptoms of ADHD. So here's how a CBT therapist might treat ADHD. 1. Psychoeducation about ADHD and its impact. So understanding the disorder. The therapist would first educate the client about ADHD, explaining its neurobiological bases, challenges with executive functionings like working memory, attention, impulse control, and planning. This helps clients understand that their difficulties are not due to laziness or a lack of intelligence, reducing self-blame and shame. And the impact on daily life, discussing how ADHD symptoms manifest in their daily life, including challenges at work or school, in relationships, and with self-management, for example, procrastination, disorganization, and emotional dysregulation. 2. Cognitive restructuring, addressing maladaptive thought patterns. So we would identify automatic negative thoughts. Individuals with ADHD often develop negative self-talk due to repeated experiences of failure, criticism, or feeling overwhelmed. The therapist would help the client identify these automatic negative thoughts, such as, I'm so stupid, I'll never get anything done. I always mess up, so why bother trying? Everyone thinks I'm annoying because I interrupt. This task is too big, I'll never finish it. Challenging and reframing thoughts. So the therapist would then guide the client to challenge the validity of these thoughts by looking for evidence for and against them. They would help the client replace these negative thoughts with more realistic, balanced, and helpful ones. Instead of, I'm so stupid, perhaps I have ADHD, which makes some tasks harder, but I can learn strategies to manage it. Instead of, this task is too big, perhaps this task feels overwhelming, but I can break it down into smaller steps. And then finally, positive self-talk. Encouraging and practicing positive self-talk and self-compassion to combat self-criticism. Then we have behavioral strategies and skill building for executive functions. This is a major component of CBT for ADHD as it directly targets the practical challenges. Time management. Prioritization, teaching methods like the Eisenhower matrix, urgent and important, or ABC method to prioritize tasks. Time blocking, scheduling specific blocks of time for tasks and adhering to them. Using planners and calendars, implementing digital or physical planners, calendars, and reminders to track appointments, deadlines, and tasks. Body doubling, encouraging working alongside another person, even virtually, to help maintain focus. And timers, using timers for focused work periods, for example, the Pomodoro technique, 25 minutes of work, 5-minute break. Then helping organizational skills, breaking down tasks, teaching clients to divide large, overwhelming tasks into smaller, manageable steps to reduce task paralysis and build momentum. Creating systems, developing consistent organizational systems for physical spaces, desk and home, and digital files, email, computer documents. Checklists, using checklists for routine tasks or multi-step projects, and do it now versus schedule it. Encourage immediate action on small tasks to prevent procrastination. Impulse control and emotional regulation. Stop, think, act. A technique to pause before reacting impulsively, allowing for conscious decision-making. Mindfulness. Teaching mindfulness techniques to increase awareness of thoughts, feelings, and impulses without judgment, allowing for a more thoughtful response. Distractibility delay. Learning to acknowledge distracting thoughts and consciously deciding to address them later, for example, jotting them down and returning to the main task. Problem-solving skills. Systematic approaches to identify problems, brainstorm solutions, evaluate options, and implement a plan. Improve working memory. External aids, emphasizing the use of external aids like notebooks, whiteboards, voice recorders, and reminder apps. Verbalizing tasks. Encourage clients to verbalize steps of a task to themselves to keep it in working memory. Sleep hygiene, addressing sleep difficulties common in ADHD as poor sleep exacerbates symptoms. And lifestyle adjustments, discussing the role of nutrition, exercise, and stress management in managing ADHD symptoms. Homework and practice. CBT is a highly practical and therapy and relies on clients practicing new skills between sessions. Therapists would assign specific homework assignments, such as using a planner, practicing cognitive restructuring on a particular negative thought, or implementing new organizational systems. Review homework in subsequent sessions is crucial for reinforcing learning and troubleshooting challenges. And relapse prevention. Towards the end of therapy, the therapist would help the client identify potential triggers for old patterns and develop strategies to maintain their gains and cope with future challenges. Overall, CBT for ADHD is a structured, skill-based approach that empowers individuals to become their own therapists by identifying problematic thoughts and behaviors related to their ADHD and learning practical strategies to manage them. It is highly effective, especially when combined with medication, as it addresses the functional impairments and emotional distress that often accompanies the core symptoms of ADHD. I hope you found this helpful and educational, and I look forward to seeing you the next time. Take care.